We have Victor McKnight representing the insurance agency, insurance industry, excuse me.
Thank you. Let me clarify that. I'm an insurance broker, work with employers as small as 2 or 3 employees up to 3, 4, 500 employees. And what I plan on doing today is just going over the House and the Senate bill. Was able to talk a couple weeks ago to 3 different congressmen in their offices, and we met with Senator Boxer's office. Learned a little bit about their views and where they thought this was going, and was able to talk to some lobbyists too that gave us a good idea of where this thing was going to head. And I do not think that there is a way that this will pass in August. That there's an outside chance that the House will pass something. The Senate has given up on it, and I think what we'll see is after the recess, after Labor Day, there very well may be something that passes, and then they're going to have to go to committee. And the 2 bills, the Senate bill and the House bill, will be very different, and they're going to have to hash it out. It's going to be a battle. So what I was going to go over was the main aspects of the 2 plans, where they differ, and what I think the consequences of both sides will be. The first off, it starts out, and if you didn't get one of these, affordable health coverage is the top of it, Coalition for Affordable Health Coverage. If you didn't grab it on the way out, it's what I'm using as a reference point tonight. But both bills are going to require that individuals purchase health insurance. And the reason why they do this is the only way to actually have guaranteed issue individual coverage. Right now, it's very difficult to get an individual plan. If your company went bankrupt and you had to go out and buy health insurance, unless you are perfect, it's very difficult. If you have asthma, if you saw a counselor a couple of years ago because a family member passed away, you may be denied. So it's very difficult to get individual health insurance at times. So their thought is we put an individual mandate on everybody has to buy it. If you can't afford it, the government is going to subsidize it, and there's going to be different penalties. The Senate hasn't clarified what their penalty is. The House is 2.5% of your adjusted gross income, up to the amount it would cost to buy a policy. So that's the individual mandate. The challenge with that is can you make it enforceable? Right now, I know if I drive out on Farmers Lane, about 15% or 10%, depending on where of the drivers will be uninsured. So, and we have a mandate there. So that's a question that I think we have to talk through. An employer mandate, and this is a big one. Employers must offer qualified health coverage or have a payroll tax of 8%. And what that would be is that employers with a payroll of $400,000 annually, which is a pretty small payroll, that might be a 5, 6, 7 employee company, or they're going to have to supply health coverage, and they're going to have to pay 72.5% of an individual plan, and if you have dependents, they're going to have to cover 65%. I know with my employers that I work with, the majority of them cover a pretty good portion, over 72.5% of individual coverage, but I have very few that cover 65% of family coverage. And that could be a real issue, I think, for businesses, small and large. Instead of an 8% tax, the Senate has a $750 penalty, which is much milder. And by the way, the tax, if you're a business owner and you opt out, your tax will not go to cover your employees. Your employees will still have to go out and purchase it on their own. And if they happen to meet the subsidy levels, they may get some subsidies from the government. So insurance market reforms, they would ban pre-existing conditions. And there would, on most group policies, there's either very little or no guarantee or no pre-existing conditions right now. We would have guaranteed issue for individuals. So if you wanted one, you'd be able to buy a health plan a single person. There'd be a defined standard benefit package that would be defined by the government. I have a very large deductible. They haven't defined if that's possible. My deductible on my family happens to be $6,000. I don't know if that would be considered the type of coverage that they would want. So I'm not sure if that would meet the minimum benefit. There would be also some changes in how they're rated. Basically, plans would probably go down a little bit for individuals who are older, but the younger workers would pay more. Right now, if you own a small business, there's rate banding. Somebody in their 20s pays a lot less than somebody in their 60s. That would shrink, so the person in their 20s would pay a lot more than they do now. The person in their 60s would pay a little bit less. There would be some standardization there. Subsidies. Subsidies would go up to 400% of federal poverty. So a family of four could, if they made less than $88,000, would get some subsidies from the government. And think about it. I just throw it out there as $88,000 in Santa Rosa is a lot different than it is in probably Little Rock or in other parts of the country. So as we think, well, 88,000, we think of what that threshold would be. As we leave California, that hits a lot more people. And then there's a tax credit for small businesses in both plans. So small businesses, typically under 25 employees, would receive some tax credits as long as they bought it from the public plan. So that's so there would be some tax credits that would encourage people to purchase it through there. The public option, and Mike nailed it when he said that the creation of the public option will be within 5 years the predominant health plan. There's just the way that this is structured, that will just happen because, as he said, Medicare pays a lot less than Blue Cross. My Blue Cross policy pays about 30% more, sometimes 20%, depending on the provider. So that's going to be quite a pricing advantage because the House bill has the public option reimbursements set at Medicare rates the first 3 years, and then after that, they'll be set by the government. On the Senate bill, from day one, it's set at the government. So yes, the public plan would have a lot of market power and would become the plan of choice. Now, I will say that I'm a little bit biased because as the public plan grows, I'm finding other employment. So I will admit that there's some bias there. But costs, the Congressional Budget Office, they are very interesting to watch because they are coming out with the cost. And they put a score on these plans. The House plan is going to be a little over $1 trillion. And then the Senate bill is about $611 billion. The Senate hasn't talked about how to pay for it yet, but they're earlier in the process. The financing on the House is going to be a tax, increases taxes on the wealthy. And then reducing uninsureds is really tough to gauge, but the CBO says that out of the 54 million supposed uninsureds, there would be about 37 million that would get insurance, and on the Senate bill, there'd be about 20 million that wouldn't be able to get it. And I think we have to talk about who the uninsureds really are. There's a lot of uninsureds. There's a lot of young invincibles, like most of us were in our 20s, that choose not to buy it. Mike will tell you that probably today somebody will walk into Sutter Hospital. They will be uninsureds. They will be admitted, and they will be on Medi-Cal by, I'm not sure how long it will take them to get on Medi-Cal, but they will get but Sutter will get compensated something for that care, because Medi-Cal in this state, Medicaid the rest of the country, is the only insurance plan that you can get retroactive.